Welcome everyone to this evening's program, Starting a Private Practice. I'm Meridith Apfelbaum, Assistant Dean of Students at William James College, and part of my role is to create career development programming for our students and alumni, hence tonight's career-related panel. Before I introduce our amazing panel moderator, 3 quick items. 1, please note that we are recording tonight's program to share with those that were unable to join us tonight. And 2, I want to publicly thank my terrific colleague, Lynn Alberding, our Assistant Director of Alumni Relations and Annual Giving, for helping to shape and promote tonight's program. I also want to thank Danielle Pace and our student ACEs also for helping to make tonight possible. And 3, please note that we will have about 10 to 15 minutes toward the end of our program to take some questions from our audience. So please hold your questions until we complete the moderated portion of our program. And with that, I would now like to tell you a little bit about our moderator for this evening, Dr. Susan Powell. Dr. Powell is a professor in the Counseling and Behavioral Health Department at William James College and a licensed psychologist and health service provider in the Commonwealth of Massachusetts. Dr. Powell has taught in graduate psychology programs since 1995, serving in senior administrative leadership roles in MA counseling programs for several years. Her teaching, research, and scholarly interests focus on diversity and difference, including race, ethnicity, social class and upward mobility, disability and physical difference, and military status. She has presented at a number of national conferences, published in professional journals, and consulted to a wide range of organizations throughout the U.S. regarding diversity and enhancing cultural competence. Dr. Powell also has a private practice where she works with individuals and couples. So with that, it is my pleasure to hand the virtual mic over to Dr. Susan Powell.
Thank you, Meredith. Hi, everybody. Thank you for coming. It's so nice to see some people. I know it's the weird thing about Zoom that most people have their cameras off, but I see some alums here. I see Devin Mavani and haven't seen you in ages. Nice to see you. So thank you for coming out for this. Let me just give you a structure about what we're going to do tonight. I'm going to ask each of the panelists in just a bit to introduce themselves. And then we've got probably about 10 to 12 questions that each person will respond to, and then we'll have an opportunity for you guys as an audience to ask questions if you have questions as well. So first off, I'm going to start with Jonathan Inns, because he's next to me in the little square. So Jonathan, if you don't mind introducing yourself, saying what you'd like to say about your professional experience. And you're muted. I just said earlier, we're saying that all the time these days.
Yes,
Muted.
I know. I do have trouble with that. I do a lot of Zoom, but I don't usually mute. So, I wanted to say thank you for having me come to this panel, and I'm pleased to meet all of you, and hope to share some of my experience as a clinician. I've been practicing for 33 years, and I trained, first I had a degree in Masters of Psychophysiology from Binghamton, and then went on to Penn State for my clinical degree, clinical psychology. And then I did a postdoc at the BI. So I was saying before that Nick Covino, I think all of you know him, and he was my internship director and fellowship director at Beth Israel. So I left there and in 1990 and went up to Beverly Hospital and started a behavioral medicine program there. I have a specialty in what I call medical psychology, which is now behavioral health or behavioral medicine, and also became the director of outpatient psych service from 1990 to 1994. And Beverly was a good hospital and the community hospital, and it was a little bit ahead of its time in some of the birthing centers that they were doing, and they wanted a behavioral medicine program as well. So I did that from 1990 to 1994. I started a private practice in 94, left there and went on my own. Started supervising several students, and we began the Medical Psychology Center in 96. And it's been growing ever since then. I have been in the Cummings Center in Beverly since 1996. And so we just passed our 25th year. We have 16 clinicians on staff, and everyone from PhDs to several William James students. We have 2 nurse practitioners who provide psychopharm, and there are also social workers and LMHCs. And we have a number of different services within that practice. Also, run a police and fire testing program, which is interesting. So in addition to running the practice, I also have a private practice, which meaning a self-pay service. So I've been on both the insurance side of things as well as self-pay, and can speak to both aspects of that. The thing that I found primarily most important in terms of behavioral medicine and medical psychology is that I reached out to the physicians early on and really developed excellent relationships. So now there are something like 300 different physicians who refer to our practice, and we receive over 250 referrals a month. We do about 1,300 visits a month, and our practice generates about $1,200,000 worth of psychotherapy. It's been an interesting ride. I think, the field is changing drastically, and it certainly requires some navigation, but I think that's the purpose of this tonight, and hopefully we can be helpful. The last thing I would say about myself is that I have the third part of my work is that I'm starting a mobile application, which I hope to have out within, I would say, a year. I'm calling it Ziva, and it's a physiologically based biofeedback program which will monitor people's physiology. And I have found in my work with biofeedback that there is an alert signal taking place in patients so that they're even pre-conscious to their awareness of the panic, like an early warning signal, like a tsunami signal. And so it's going to be very exciting. I'm working with a German data scientist doing the AI, and so the thing about psychology is you can do so many different things, and this has been a nice sort of last piece of work, which I'm hoping one day all of you will be using. So that'll be good. But so that's my story.
Great. Thank you, Jonathan.
Thank you.
Ashley, would you go ahead and introduce yourself? Ashley Mayo for everybody.
So I'm Ashley. I was a grad of the Master's in Counseling and Health Psychology program in 2015. Right before then, I was doing some research, and during actually my time at William James, I was doing some research at Harvard Med School on cancer disparities in rural populations and different socioeconomic status. So a lot of access to healthcare issues and a lot of public policy stuff. After leaving William James, and while I was there my last year, I was also working at Walden Behavioral Care, which is an eating disorder center, and doing a lot of my training around eating disorder work and health psychology, and really found I have a love and passion for treating clients struggling with eating disorders. So that's the primary, I'd say it's about 65% of my clientele right now in private work, and even throughout leading up to going into private practice. So I was at Walden for about 3.5 years, and then I moved up to New Hampshire, where I had to redo some licensure hours, which was a bit frustrating. So I was at community mental health for a while, still doing a lot of eating disorder work, and getting all of those referrals, and then moved to a group practice briefly to get my footing under me and continue my connections with Dartmouth College, which is nearby, and Dartmouth Hospital, and started private practice just over a year ago, and it has really taken off. Wait lists are always a thing, and have an intern starting with me in September. So that is exciting.
That's great. Thank you, Ashley. Gureen Singh, could you introduce yourself, please?
Absolutely. Hi, everyone. My name is Gureen. Thanks so much for being here and listening to us talk on this really important topic on this really dreary evening. I graduated from William James with my master's in counseling psychology in 2013. And started working in community mental health, doing in-home therapy, mostly with kids and families, and then moved on to doing outpatient work in the same community mental health center. I did that for about a couple of years until I got my hours under my belt for licensure, and then got my LMHC in 2015, and was offered a position to be a supervisor and a site director at another community mental health center. Did that for about a year, and then decided to go out on my own and start my own private practice, which I did in February of 2017, followed by a group practice the year after in October of 2018. And since then have been doing both of those until now. So I have my solo practice where I see mostly adults and some couples, and focus mostly on doing long-term psychodynamic work, which was always a passion of mine. And, on the other end with the group practice, just really focusing more on making some systemic change and accessibility to clients that don't always have that, and working on a larger macro level on that end. So that's a little bit about me.
Thank you, Gureen. And last but not least, Michael Weinberg.
Hi, everybody. I'm Michael Weinberg, and I graduated in 2015 from the master's program in counseling and behavioral health. And from there, I transferred right away into the clinical PsyD program and graduated in 2019. And along the way, I accumulated hours for my LMHC. So I got that first before I graduated, actually, in 2019. And from there, I then went and somewhere I graduated, I started my private practice part-time because I was also starting my postdoctoral fellowship so I could work towards my psychologist license. And eventually I did accumulate hours for that as well. So I'm a LMHC and a licensed psychologist. And I did all of this stuff sort of full-time and part-time, and whatever I needed to do, pass all the exams, all that fun stuff. Continued with my practice. And then after my postdoc was done, then I became a clinical supervisor at that site, which was Star Stanley Street Treatment Resources in Fall River. And then basically thought I was going to be full-time in my private practice, but then there were opportunities to do some teaching at William James, so I also do that. So I do a little bit of everything. So teaching, supervision, private practice. It's a wonderful career that you can have. Pretty much do whatever you'd like to do, really. And so my practice is in Newton, 10 minutes from the school. So I guess I haven't really left too far.
Great. Thank you, Michael. Thanks to all of you for being here tonight and offering your wisdom to our students, current students and alums. So I'm going to start with the questions now. And I'm going to ask Ashley to start off with this first question. Why did you decide to pursue private practice? Some of you may have already answered this a little bit. And did you first start doing it full-time or part-time?
So I knew, I think from my time at William James, that was the long-term goal. I really enjoyed being in a higher level of care when I was at Walden, but I think if there's any of you doing internships or working in that setting now, it can be a lot. It can be really demanding. So I currently have an 18-month-old. I'm trying to think how old he was when I decided that it was time to bite the bullet and go for it. I had a lot of good colleagues around me who had been encouraging me for about a year before I decided to do it, to go out on my own and do it. So when I was in my group practice was when I really started getting the ball rolling. I realized I was basically doing all of my own scheduling and insurance stuff anyway. So decided I could do it on my own and take a little bit more away financially. So
Great, thank you. Jonathan, how about you?
I had did not really plan on doing a private practice. I was running a medical psychology center, running the Beverly outpatient psychiatry, but was getting a lot of referrals to me directly. And so I went off on my own to do that. And then did that part-time, and then over time built out a full-time practice. And then 2 years later started the group. So yeah, so it was a gradual process.
Great, thank you. Gureen,
Yeah.
how about you?
Yeah, so private practice was always on the horizon for me, but I definitely thought I would do it much later in my career. To be honest, as part of the community mental health world, started to get pretty frustrated with not being able to make some systemic kind of changes that I really wanted to make. So even though I had a higher level position at the community mental health center that I worked at, I found it frustrating to just kind of run into that roadblock of not being able to make some of the changes that I really wanted to make. And so decided to go out on my own and started the private practice. It was pretty scary actually to start. So I want to just validate anybody out there that is scared considering this as an option. So for me, it was really helpful to seek a position, a temporary position to cover a clinician's maternity leave at a college counseling center. So I started working at Mass College of Pharmacy for a temporary position in the fall of 2016 into 17, while I considered if private practice was going to be the way to go for me. And so I started very slow with just a couple of blocks, like 4-hour blocks on days that I wasn't working there at MCP, and loved it, and realized that I was getting full pretty quickly, and there was a lot of need, especially for clinicians of color. And so that's kind of how I started. And so it was definitely part-time. And once that position was over at Mass College of Pharmacy, I decided to switch full-time to doing private practice that fall, and have not looked back since. So.
Awesome, thank you. And Michael, how about you?
Yeah, so I had been in the working world for a good number of years, so I knew I was sort of done working for other large organizations. So I was really always looking forward to starting my own practice. And there's also an entrepreneurial spirit that runs in my family, so there's that as well. And I just was very excited before I opened it officially. I listened to all these different podcasts. There's Facebook groups you can join, and there's so much information out there. Of course, a lot of these different groups want you to join up and pay them some type of subscription fee, but you can definitely glean a lot of free information from it all. And yeah, just having my practice felt like liberating. You get to decide, but there's also a lot of responsibility that goes with that. So a lot of organization, a lot of details, and the buck stops with you, so to speak. So if that's what you want to do, I think it's just wonderful and amazing. And I see primarily adults. I do have a few couples. And in terms of the populations that I see, I do have almost half of the folks that I see are in the LGBTQ plus population. And I also love working with older adults.
Great, thank you, Michael. So the next question, and I'm going to ask Jonathan to start off with answering this. How long did it take you to get a full caseload? And what do you consider to be full or full-time?
Yeah. So I would say it was gradual. I mean, I found myself with lots of referrals. I think it was, at the time, I was probably doing 20, 25 hours, what I considered full-time. And back then it was, the managed care was much more of a burden than it is now, actually. And so I wanted to move towards self-pay. And so that was a matter of putting myself out there. And in the sense of the fear, that's one thing I would say is very powerful, is that you really have to have confidence in yourself and put it out there. And so what I did was I started reserving blocks for my private practice, not taking on new patients in managed care, and it worked out. So you just have to like put it out there. I remember I made up at the time, you would send out postcards, and believe it or not. And so I printed up these postcards and I hung on to them for like 6 months, fearful that I was going to put it out there and no one was going to respond. But luckily they did. And that's, so in terms of the caseload, I see a lot of people. I'm, been doing this a long time. I feel like I'm really well trained. And so I see probably 40 people a week. And I also direct a practice and I'm doing this research. So I'm a bit of a hardworking guy, I would say, but it does require a lot of organization. The private practice is much better because it's just, I take credit card. I have a simple practice as my organizational system. And so I don't have to, muck around with checks or anything else. So people just, and it's very quick and you can do your notes in a very quick way. So I have gotten very efficient in terms of the number of people I see. So it's a large caseload, but I love the work. I mean, I couldn't ask for a better career. So,
Great, thank you.
yeah.
Gureen,
Yeah.
how about you, Gureen?
Yeah, so I started, like I said, with limited spots that got filled up pretty quickly. But what I realized early on in my prior practice was that the fear of not filling your slots is real. And I think that, it can be scary to think that this is your only livelihood. And I think that transition can take some time. And so I think that, well, it took me about a couple of months once I started full-time. So I started full-time in September. And I think by October of that year, I was full. But the asterisk there is that, I think that I was eager to get clients in the door and was okay with working with a lot of different types of clients, which I am now too. But I think that as you develop your prior practice, it becomes more of a funnel approach where you work your way from folks that have a lot of generalized anxiety. You work with folks that have depression. You work with folks that have relationship issues. And then as time goes on, for me, I realized that the work that I wanted to do was much more specific with specific clients. And so as time goes on, I think the trick is to make your profile more specific to the clients that you want to work with. And so I found that to be really helpful over the last few years, and have been pretty much full. Waiting lists are definitely a thing and don't have a lot of openings most of the time. My full caseload, I would consider 28 to 30 clients, but because I'm also doing the group practice and trying to have some healthy work-life balance, I only see about 20 to 21 clients, and the rest of the time I'm working on the group practice.
Great, thanks, Gureen. Michael, how about you?
Sure. So I started in the summer, and after I graduated from the PsyD program, so I was also working on my postdoc. So the summer was a little bit slow, but after a few months, what I considered to be a full practice was about 15 to 20, just because I had another job that was pretty consuming. But after a few months, it definitely was full. And I happen to use therapy notes. I know Simple Practice, I heard mentioned a couple of times. So those tend to be the two big EHRs. And I happen to take insurance, so I can tell you, like, the modern technology and software makes dealing with insurance so easy. As soon as you're set up, that's the hard part. But it makes having a practice doable with your notes and scheduling. It does pretty much everything you need. The thing is that now that I'm also teaching, like I've scaled back a little bit. So maybe I'm like 10 to 15 clients per week, something like that. And, it is also important to give yourself time off. Even though in your own practice, you don't get to continue getting paid, you still need to take a week off here and there for things like that. But yeah, it's been great since I started, and I naturally recommend it. I think that's why we're all here.
Thank you, Michael. Ashley, how about you?
So I was in my group practice first, and I had gone out on maternity leave, came back. My clients were, I luckily didn't have a very strict non-compete and had done a lot of my own marketing during my time at my group practice. So all my referral sources knew ahead of time that I was leaving. So I went from having a full caseload at my group practice to having a full caseload in private practice. However, I transitioned from taking insurance at the group practice to going self-pay, which that anxiety was so real of all my clients. And I had people to give them to if they weren't able to make that transition to self-pay. The majority, I think it was 2 or 3 that I left behind. The majority were able to come with me. So I was up and running right away. I also use therapy notes. I love it. The fees are a little less than simple practice, which was the only deciding factor for me. But it's great, makes everything super easy. Like John was saying, I just take credit cards. I don't do checks or anything like that. And they're on file. It just gets billed at the time of the session. So full caseload for me is about 30 to 32 hours. I fit that into Monday through Thursday, and then I do some supervision and consulting work for one of the community mental health agencies, on Fridays, and have time with my son, which is nice.
Great, thank you. Okay, the next question, I'm going to ask Gureen to go first on this. How do you get clients referrals?
Okay, that's a great question. So my primary source of referrals is Psychology Today. So I have a profile on there. I think most people do, and emails come through there. I also am in contact with a lot of college counseling centers in the area. I mean, of course, with COVID right now, it's been difficult because a lot of college students are not here, but I'm sure that is going to change in the fall. So in touch with a lot of college counseling centers, and Susan is another referral source. So former colleagues, former professors, you know, word of mouth, that sort of thing.
Thank you. Michael, how about you?
Sure. Yeah, primarily it's Psychology Today. It's about $30 a month. And you can get the first 6 months for free through your liability insurance company. So that was really helpful when I started off. Just you want to minimize every single expense as much as possible. And I also have a website, you know, which some people look at. You know, they look at Psychology Today. They can click and go to there. They can look at insurance company websites and that type of thing. And sometimes there's some word of mouth, but honestly, Psychology Today is just phenomenal. Really, I think like Gureen, you were saying, you have a wait list, probably we all do. People just find you, and especially these days, there's a huge demand. And so we'll see what happens as things hopefully get better with the world global situation we're in. But yeah, that's primarily what I do. It's like today.
Thank you.
If it's okay, just want to add that you also get 6 months free if you know somebody on Psychology Today already and they refer. If you give them an email and they send you the link, you also get 6 months free. Just a plug out there for Psychology Today.
I never got 6 months free. I can't believe this. I'm going to go back and demand it.
You should.
Do it.
Yes. Ashley, how about you?
So a lot of with the eating disorder work, there's so much collaboration and constantly talking to primary care docs, dietitians. So I had a pretty, because even being in Mass, we did a lot of overlap with New Hampshire, and Cambridge Eating Disorder Center has some locations up here. So luckily I kind of had a network of colleagues that had been created while I was at William James even, which was really, really nice. So when I came up to New Hampshire, I had started reaching out knowing that I wanted to get into private practice within the next 3 years or so. So had that network already created. Psychology Today is amazing. And it's also really nice because I'll get some other cases in, which is really nice to just have some like anxiety, depression, some of just like my teenage clients that come in and don't have eating disorders, a nice change of pace. And definitely is really nice to have that wait list, but also the colleagues in the area, because we give referrals to one another too, so that we're not having someone sit on our wait list for months and months, hopefully. So I'd say psychology today, but definitely networking. And if you know, even if you're not quite there yet, a good confidence builder is starting to reach out to other area providers and letting them know what you're interested in, the type of clients you'd want to see, just to get your name out there off the bat. That was really helpful.
Great, thank you. Jonathan, how about you?
Yeah, so I would, in addition to the psychology today, I think there is a reality that there's just so many more people looking for therapists than there are therapists to see them. So that's one reality in terms of the busyness. I don't think there'll be any problem with anyone establishing a practice, which is unfortunate, but good for us, I guess. Good problem to have. But I would also echo what Gureen said about the specialty, like I'm trained in more exploratory therapy, and I like deeper work. And it's the kind of thing where if you establish that as your, what you're doing, then people know to refer to you for that. And so I do get a lot of referrals at this point. Been doing a long time, so I get a lot of referrals from, physicians, the physicians themselves, it's friends of people, that kind of thing. So there is a lot of knowledge of, as you establish yourself, you begin to get reputation, and people will refer to you. The one thing I would add that I think is really important for people to know, if you are in a situation where you are doing both clinic work and also a managed care arrangement, insurance company based, you can also have a second NPI, which I don't know if people are informed about. But it's a very much helpful when you are providing to the community, but also people who can be self-pay, that there's a second NPI for just your private practice, which I did not know about until this couple of years ago. And it really allows you to say, I'm seeing you in my private practice for self-pay arrangement versus an insurance-based claim. And so people would say, well, why are you, you're listed as a Tufts provider. How come you're charging me for self-pay? And well, this is a separate entity, really. So I've always had I had JN's PhD, LLC, but then I also ran Medical Psychology Center. So there had to be some differentiation. I would really strongly encourage you to look into it. It's not expensive, and it really helps to separate out your channels.
Can I add to that too? So in my self-pay work, you can, with having a specialty in something, so all of my eating disorder clients that request this, I give them a super bill that they're able to give to their insurance company. You don't have to do anything. Therapy Notes or Simple Practice generates it for you and keeps you out of it. You get paid at the time of session. All of my clients who request that are fully reimbursed and that's, I believe, more eating disorder specific and also DBT specific. So I have a certification in that.
Fully reimbursed for the total fee, or your?
Yeah, for the total fee.
Is your fee the same as the insurance-based fee, or the? No.
No, and I don't know if that's been different since COVID, but they've had good luck with that.
That's great. Yeah, thank you. Okay, so the next question, I'm going to ask Michael to go first on this one. What was involved in getting on insurance panels? How long does it take? And what's the fee schedule like for a 45 versus 60-minute session? And if you guys could speak to, and Michael, you might be very well able to speak to this, the difference between payment, the fee schedule for master's level versus doctoral level.
Yeah, the payment differential can be quite significant. So, but first, to get on an insurance panel, so there's something called the CAQH profile. It might be caqh.org or something like that. But if you just Google that, you fill it out. It basically asks for your life story, put all the data in, and once it's there, then you can start filling out these forms for all the the big insurance players like Blue Cross, Tufts, Optum, whoever you want to be on the panel with. And usually the paperwork for them is just a couple of pages, very high level, maybe a few detailed questions, but they all use this CAQH profile. So if you want to deal with insurance, it's commercial private insurance, that's what you need to do. That's the first thing. in that first profile, it can take a couple or a few hours because it wants like all your, like everything on your resume plus a lot more stuff. So then you wait. It can take a couple months, a few months. I think Blue Cross was pretty quick. The whole contracting process was 2 to 3 months. Aetna, I think, took a year, and I've only had 1 or 2 people using Aetna, but they happen to pay the most, just FYI. That's my experience. So it certainly doesn't hurt. You know, other things you need to keep in mind is that it's helpful to have a bank account. So I happen to use Digital Credit Union. Fees are 0. I'm really big on that, like not liking to spend money for your practice as much as possible. I get great service. So, because I like to get direct deposit or ACH deposits from the insurance companies. So that's what you need to do. And you just need to be a little bit patient, and it helps to sort of check in with them every once in a while just to see what's the status, how are things going, or things could happen. Like with Tufts, for example, I found out that I was contracted because someone called me and said, "Oh, you were on the insurance company's website. You take Tufts." And I was like, I guess I do. I guess all the paperwork went through. So those are just some things. If you're a bit patient and organized, it'll be fine. It'll all work out. You know, in terms of the payment, so my understanding is we're not supposed to say what the exact amounts are. At least that's what the APA says. So, but what I will say is that at the psychologist level, I mean, it can be anywhere from, I don't know, like 30 to 50% higher than what the master's rate will get from the insurance companies. And
you give us a range. Frankly, I've never, I know that insurance companies don't like to make their fee schedule public. I didn't realize that was an APA.
Yeah, it's been talked about. Yeah, so the way it works, Susan, is when I read the explanation of why it supposedly makes sense, I get it. And then later on, as I think about it, I was like, I don't really understand why we can't talk about the rates. So the master's rate, so if you do the 90834, I think it's under $100. But if
and can you tell people what 90834
Oh, yeah. So that's the 45-minute session. I never do those. I always do the 90837, which is the 53+ minute session. And so that extra 8 minutes will get you so much more. It is worth it. So you can still see people every hour. You just have to be very aware that, that when that 53 minutes hits, you need to get your notes done and just be organized on top of things. So doing the 53+ minute session, that can be usually, it's been a while since I recall the master's rates, but it can be 100 to 120, I think, something like that, 120s. Whereas the psychologist rates can go from anywhere from roughly like 120 to like 170s. And most of them pay like around 150 plus or minus, that type of thing. So definitely some big distinctions there. And there's a lot of controversy supposedly about using the 90837 code, the 53+ minute, because insurance companies supposedly don't really like people using that code because obviously they want medical necessity to be shown. But I've had absolutely 0 issues using it. We're also in Massachusetts, so we have strong advocates in this state. The MPA, Mass Psychological Association, deals with the insurance companies, talks to them regularly. I do, through some Facebook groups, I do hear about some other states being picky about the 90837. You may get audited, that type of thing. I've had zero issues. So it's well worth it. And it's also good to give your patients or clients those few extra minutes.
Thank you, Michael. Jonathan, how about you?
Yeah, So the one thing I would say first about the 90837 or the 90, what is the 53-minute code? Is that 90837? Yeah. That really was not intended for every session. I mean, that's you've been able to do it and people do it, but you wouldn't want to be audited for it either. It's the kind of thing where they were fairly clear when they first started off that this was for trauma or for more intense kind of situations. So I think that's a cautionary kind of tale. I wouldn't do it with every one of my patients. I know people do it, but I think it's there's a potential for danger to you in that regard. But what I would say is that the other thing about the 90837 is that you have to indicate when you begin the session and when you end it. So you're supposed to list those details. If you are ever audited, they want to know when you began and when you end. One thing that most people don't know about is that in the initial evaluation, you can actually, it was Michael Goldberg, I don't know if people know him, Dr. Goldberg from Children's, he was the president of Mass Psychological for a while. Anyway, I had consulted with him and he indicated that you can have two initial evaluations, which insurance companies don't have a problem with. So it's a way of continuing to get the higher fee of the initial evaluation for 2 sessions every time. So that's something, as a clinic, we do that for all of our patients. And I think that's a helpful thing to know. I would also say in terms of getting on panels, that it's also helpful if you're ever not on a panel, it's very helpful to have the patient advocate for wanting to have you on that panel. So there are times where they will hold back your admission, but you can get the patient to advocate for themselves and for you. And that's, you're not the customer of the insurance company, the patient is. So that's who you go through. On average, I mean, we keep very close stats at the MPC, and the PhDs average around $100 an hour from insurance companies, and for their average work for initial evaluations and 90834s, and then about $80 for master's level. Interestingly, they don't reward PhD social workers for some reason. They don't give a PhD level status for that, just to know that. But that's the fee on that. So I think those are the things I had to say.
Thank you. Yeah, Ashley, you want to respond to that?
Sure. So when I was in my group practice, they did my paneling for me. And they knew I'd given them about a 2 months notice of leaving community mental health and going to the group practice. By the time I got there, I was paneled with most insurance companies, and they said that was really quick, and usually it takes longer. In New Hampshire, I've heard it could take up to 6 months to be paneled with certain ones. So in making the choice to go private, kind of speaking to what Jonathan shared about rates, and knowing what my clients, some of them were self-pay at the time of my group practice, knowing what they're capable of paying and willing to pay and how I value my time, really centered my choice around that. And I do offer sliding scales in certain cases, and offer consultation to some colleagues in the Community Mental Health Agency and a few group practices around eating disorder work, to try to make up for kind of giving back in that way instead. So like I said, with the super bill, I don't know if it's just because of COVID that they are being so lenient with how willing they are to reimburse my clients fully. I do know I think it was Blue Cross, I talked to a rep about one of my clients who was stepping down from a higher level of care and why I would be seeing them, which I don't usually do that legwork. It's pretty time consuming. But I did in this case. It was a referral directly from a colleague, and she said that the family would be being fully reimbursed due to in the area that I'm in, there's no other eating disorder providers outside of me and one other person who's about 30 miles away from me. And so I'm kind of the sole referral for Dartmouth and the college. in the high schools nearby. So I think that's kind of where they're having luck with that. So anyone who wants to do eating disorder work, Hanover's lovely.
Yeah.
Feel free to reach out.
One thing I would add about the what you just mentioned there, Ashley, was about you can, and I've done this with insurance companies. If you have a specialty, you can renegotiate your fee when it's time to renegotiate the contracts, and that's something that's not publicized either, and something to know. So if you have a specialty, they will pay you more for that because they want to be able to say that you're on their panel. So it's about a confidence thing to step up and be able to say that. On the thing that Michael was addressing with the time frame piece of it, that they have rules that they have to follow. They don't always do it, but you can call them up and say, like, if it's being delayed, they have a responsibility. It states in their contract that they're going to get you credentialed within, like Blue Cross Blue Shield is 90 days. And so you have a right to sort of make sure that that happens also.
Great, thank you.
Yeah.
Gureen, you want to reply to this question?
Absolutely. So definitely CEQH is the place to start because that's the credentialing part of getting on panels. And then each insurance company has a contracting part, which is specific to the insurance companies. So start with CEQH and then go into the insurance panels that you would like to be a part of. I personally am not on every single insurance company's panel. I'm only on Blue Cross Blue Shield's panel, and I'm more than happy to share their rates. So for a master's level, the intake session, which is usually reimbursed for a little bit more, that's the 90791 code. That one is reimbursed at $127.56. The 90837, which is the 60-minute ongoing, that one is the one that one is at $123.70. And 90834, which I know folks were talking about earlier, that's $82.65. And then I actually also pulled a couple others for couples, for a couple session. So you can bill that as your for a couple session, or for if you're seeing a minor and a parent joins in the session or a caregiver joins in the session, that's 90847, and that is at the $92.67 amount. And then if you only are speaking with a parent or a caregiver, that's a 90846, which is at $89.60. So these are all the master's level rates. Yeah, this was updated, I think, September of 2020. The piece I want to add about the paneling process is by no means do you have to be on all insurance companies' panels. It is not a requirement to see clients in private practice. You can always bill as an out-of-network provider if clients have out-of-network benefits in their plan. Does it come out to be more expensive for the client? Yes, absolutely. But it is another way to balance out your caseload where if you have, so for me personally, I balance my caseload with certain Blue Cross Blue Shield and sliding scale clients, and then I take a certain amount of self-pay or out-of-network clients. So you can balance bill them, which essentially means whatever the insurance company pays you, they pay you, and then you are able to bill the rest of it to the client. So just want to put this out there that not every insurance company needs you to be on their panel in order for you to see clients and use their insurances.
I would add one thing too, if you, it can be hard to get off of insurance companies panel. So in doing your research of what insurance companies you want to be part of, just be really thoughtful about like if you agree with their rates and their plan around or their willingness around increasing their rates, because getting off of it, you have to jump through a lot of loopholes for.
And I'll add, in terms of your rates and asking for raises, just general ones, not if you have a specialty. I've had pretty good success with that, and you just generally can ask about once a year. With the exception of Blue Cross, I have a great relationship with my representative over there, but he said Blue Cross almost never gives general raises. But all the other panels that I'm on, they've been very good about giving raises. So that's something to keep in mind. Don't be afraid to ask. And yeah, even with my Blue Cross person, we did talk about using the different codes, and that she was, at least for me, she told me that, you can use 90834 through 7, and they're not really interested in dinging people or anything, but it depends on your relationship. And you do, like Jonathan, you're saying, I think you have to be aware. You don't want to see people like 2 or 3 times a week and use the 53-minute code. So it's something you determine how you're going to use it. And I've talked to a lot of people about this type of stuff. So, and that's the other thing, you can network with a lot of people and hear a lot of different things and learn about all these little things to help optimize your practice.
Okay, great. Thank you, guys.
Just one thing for Michael's response. I agree with it stimulated my mind that one thing that a lot of clinicians are afraid of is to see people more than once a week. Insurance companies do not care about how often you see them. They used to, but they don't anymore. So it's the kind of thing where it's how micromanaged our patients' care, and that's the thing that's really very different. Doing away with authorizations. Believe it or not, it used to be every 3 sessions when I first started. It was like you had to get an authorization for more visits, but now that's not the case. So do not be afraid of doing depth work and being involved with your patient's care. It's for their best interest. The paradox, I think, to me, that's always struck me is that it really is about medical necessity, which Michael mentioned, and which is a hard case to make, but that's also sort of gone by the wayside. People don't ask that question, but it's really what's one of the requirements of it. But so I just wanted to put that out there about the frequency of visits. Don't be afraid to do the kind of work that you like to do.
Great. Okay, so in the interest of time, I'm just going to ask one more question and then open it up. I know that there was a question in the chat, so we'll get to that. And I think it got answered in the chat, but we'll open it up to the audience in just a bit. But the last question I wanted to pose for you guys, and I'll ask Ashley to go first. What are some good tips for financially managing your business? So things like startup costs, keeping your overhead low, et cetera.
So in planning, you want to think about office space, looking into different locations. I made a spreadsheet for myself, and I have a partner who's lovely and great at math and loves spreadsheets, so did a lot of this legwork for me. But a big part of it was really being mindful about, like, Psychology Today. It's super cheap, but you want to write all those things out: office furniture, office space, and make that plan for yourself ahead of time. I'll be honest, my startup cost was about $2,000 to $2,500, including my rent deposit. I furnished my office like very cheaply and in a great little college town. So also did it at the kind of very start of the pandemic. So I think things were a little bit cheaper in terms of finding space, because it's something people weren't looking for. But I think just have a plan for yourself ahead of time. It's something to save up for, and then it pays for itself very, very quickly. I think my practice in the first year generated just under 200,000, and our overhead cost is under 15,000.
That's awesome, Ashley. Great. Gureen, how about you?
Yeah, so spreadsheets are awesome. I am terrible at them. My partner, not so much. He has helped create spreadsheets literally about everything. Formulas and pivot tables are his thing, mine not so much. So he actually helped create a spreadsheet where I put in every week how much comes into the bank, how much goes out of the bank, and then there's a calculation for tax, which, by the way, you have to pay your own taxes if you have a private practice and that's the only thing you're doing. I put it at like 40% because I want to overestimate and have extra money than underestimate and then scramble. And then at the end of the day, I will just put in how much I'm paying myself. So it's like a weekly kind of tab of how much money is coming in, how much money is coming out, taking taxes into account, and then what are you left with? It's just really good practice. I found that to be super helpful. I also create profit and loss statements at the end of the month to see kind of how the business is doing. It's just like a snapshot again of money in, money out, what your profits are looking like. I also think that with subletting your office, if you have a full-time office, subletting your office to another therapist that might be looking for 1 or 2 days in the office can be another really awesome way to supplement your income and help pay for a portion of the rent if you're not using your office full-time. In terms of COVID, I think that the overhead costs are even lower at this point if you're trying to start a private practice, because you really don't need a physical location to really start seeing clients. All you need is a Zoom account or a private, like Simple Practice has a great telehealth portal. All you need is that and set that up and you're good to go. I will, however, say that in order to get your tax ID, which is different from your social security number, but is attached to that, and that's how the IRS monitors your income, you do need to have a physical address, a physical practice address. I believe you can use your, I'm not sure about this one, please somebody check me on this. I'm not sure if you can use your home address until you get a physical location or use another physical location. But I believe you need a physical address to apply for a tax ID. But in the time of COVID, I think it's really actually way lower the startup costs are even lower in terms of starting. Let's see, the one thing that I did right that I struggled with initially in terms of finances was having difficult conversations with our clients about money. This is one that I think gets overlooked when you've set up a private practice. At least for me, I really kind of struggled with setting my rate because there is this internalized shame maybe or something, imposter syndrome, all of those combined of how much my time is worth and really working through that. And then having some of those hard conversations with our clients about this being a service and, how much you're worth and can we have those conversations. I also take credit cards, and in the beginning, definitely ran into issues where folks forget to pay their copays if they're not being charged at the time of service. And so there were clients that had months upon months of unpaid copays. And so I came up with a policy that at the end of the month, if you have an outstanding balance, we're going to charge that. So things like that, where you can make changes to your policy because it is your practice, and being smart and thoughtful about that and putting some of those guardrails in place can be super helpful in making sure that you have a profitable business.
Can I add one really quick thing about the taxes, because it's such a good point that you're making. So we work with an accountant, and very small fee. I'd have to look it up. I want to say it's like $500 for the year, where he helps break it down into quarters. So we pay quarterly for the practice as opposed to the big payment at the end, which really helps to manage. And then I pay myself from my business account to my personal account each month after doing that net gain statement. But I think the tax piece is a really, really important one. I think I'm not a super business, I think I'm more business minded now. I wasn't a super business minded person. It wasn't something that had naturally occurred to me to think about. So having an accountant or even a financial manager in your corner, if you don't have a partner or family member who's really savvy with spreadsheets, like my partner in Gureen's, it's super helpful. And usually it's not that big of a cost, especially with how well you'll likely be doing in private.
Okay, thank you guys. So Jonathan or Michael, do either of you have anything you want to add to that before we open it up to questions?
I would just quick couple of things about I would really recommend people to think about if they are good with billing or not, because the billing is a big piece of this in terms of how you get paid. Simple Practice does a really nice job, but I've always had a biller in my practice, but recently I came across a company that does it and they charge, I think it's like 4%. So when you think about volume and how much you're doing, and so it might be worth it to have somebody manage your accounts, and then they're really responsible. And the person I use this company is great. So that's something to think about. And then also was mentioned before about vacation and personal time. One of the things that I did early on was I set up a certain, blocks of time that I was going to take vacation. And you can't, people have talked about it as a private practitioner, they don't take as much time as they should. So it's really important to calculate your income based on, I would think, at least 48 weeks rather than 52. So you want to plan for some time for yourself. And that's the other piece that I would say. And the other thing I would add is really important in terms of like no-show fee. One of the things about training is that you value yourself. And then I think it's also a contract. I have a very, sort of clear business-like contract, and you go through it with the patient in the first meeting, and then you put it away after that. But it's very clear about no-show fees and late cancellations. I don't believe in like giving people a pass the first time, all those things that are, that might be like, I don't want to be a bad guy kind of thing. You're a professional. This is your time. You've saved that time for them, and they have that responsibility. And some of the most powerful work that I've done is when there's been some kind of rupture because they're upset that I'm charging a no-show fee, or that, it's like, well, how could you do this to me? You're my therapist. Well, that's what I'm doing with you. I'm your therapist. And that's going to mean that there's going to be conflict sometimes because you don't really, whatever the circumstance. But I just would put that out there as a comment about a contract I found very helpful. And it goes to the idea of developing a container for the work, which I think is really useful.
Okay. I'll just add.
Yeah, go ahead, Michael.
Yeah, sorry. I'll just add quickly. I rent a furnished office, so that saves me on a lot of fees. My startup fees were practically nothing, to be honest. And yeah, no, it's a good point. A lot of people use billers. I do my own billing. Saves me. It is an investment of my time, but I use therapy notes. I hear from people that use Simple Practice. They can do a lot of their own billing. Saves me money. Once you get good at it, it's literally just a couple clicks and off it goes, and you wait for the money to come in. So, I would say probably the full cost of everything is like $1 per claim, something like that. But I'm very comfortable with that, and I'm very invested in collecting money for my practice because it's mine.
Excellent. Good point. So I think what we can do is have time for a few questions, and thank you all for your thoughtful responses to these, by the way. I think what we'll do is we'll pose a question, and rather than each person taking a turn at it, one of you can jump in and answer it. And if somebody wants to add something, they can. Meredith, did you have one you wanted to ask, or?
Yes, I actually, I'm just going to ask the student to unmute herself and ask. I did get a few private messages. So, and before I do that, I just want to say also thank you to you, Susan, and the panelists. This has been such a rich conversation to this point. So thank you so much, which has inspired these questions. So, Nicole, if you're still on the Zoom, would you like to ask your question of the group?
Hello, yes, that'd be great. Ashley, I believe you mentioned the super bill a few times. I was wondering if all insurances take this, or is it that certain insurances have to have the separate out-of-network availability for the super bill to be submitted?
I believe that typically they have to have out of network. However, where my clients have been more successful is because they're seeing me for eating disorder care specifically. So it falls into their in-network coverage that way. So there's like an exception that's made around it. And on my end, all I do is Therapy Notes generates it for me. I provide it to my client and they deal with the insurance piece. But there are, I think Gureen mentioned it, out of network coverage when they use the super bill that usually works not to the full rate. And then there are certain insurances and clients that won't have out of network coverage where, in my experience with other colleagues, it doesn't go through.
Awesome. Thank you so much.
Absolutely.
Great. And Jen Brownstein has a question.
I have a few questions, but I'm going to pick one for now. And if there's time, I'll ask another. So I just started doing virtual private practice, and I'm running therapy groups. And I'm curious if any of you run groups and how do you market them? Because it's a passion of mine, but I find that it's hard to get people to join groups.
So I run a DBT group for adults and teens. And then I was running a CBT eating disorder group that wrapped up. Great to market with schools. I get most of my teenage group is from the 2 high schools nearby. And then I was doing a preteen group a while back. I just don't have room right now. So reaching out to school guidance counselors, doctors' offices even is a really good one. And then word of mouth through colleagues can be really helpful. I don't know if this is in your location. We have a listserv here where there's all, we call it the Upper Valley. All the therapists are on it. So we market things that way too, or make a flyer and send it out to everyone, and they'll give it to clients. That can be helpful.
Thank you.
I wonder, Meredith, is it okay if I jump in and have Jackie ask her question? Because I think that's an important question.
Please.
Jackie, do you want to ask your question?
Yeah, I would love to. So I apologize or forget who said it, but someone said it's difficult to get off an insurance panel once you're on it. What is the downside of being on, say, an insurance panel that you don't want to be on anymore? Say, because the rates, I don't know, what's the downside?
That was me. So going into private, a few of my clients that came with me from my group practice were trying to get reimbursed with the super bill, but I was still listed as a network, but I was under my group practice's NPI. So they had to jump through hoops to show that that wasn't my NPI or my tax ID. And in order to get off, I had to make multiple phone calls, emails, delete my CAQH account. Like it was a lot.
The second part of your question, I think, is important. And I'm sorry, I got distracted. I don't know if you answered it, but are you required to take clients with that insurance if you're on the panel?
No, you don't have to take them. If you have another way of seeing them, you can see them for that, but that's where it gets complicated. That's why you need to have a second NPI and a tax ID number, because you can have 2 entities. You exist as a professional, but many people work in a clinic, but then also do private practice. So if you want to not take the insurance, then you can say to them, I'm only able to see you through my private practice. That gets a little sticky sometimes because people say, but you're listed on the insurance panel, but you have a right to say that that you're not taking patients, or you have your full. I mean, that's where it gets a little gray. But you can say, I'm not able to take you at this time, or there are a number of things you can say, but you have a right to say no. And also there are insurance companies that change their rates over time. I haven't had that same trouble that Ashley said. I mean, we used to take Fallon a long time ago, and Fallon was so bad that we just removed ourselves from it. But I think what's true about it is that the insurance companies are terrible in terms of, they don't really care to change your status. Like I had one patient that they submitted to Tufts, but I was not taking them through Tufts. And so then Tufts said, well, you should take them through Tufts. And I said, no, I'm not taking them through Tufts. And it went on for like 6 months or longer, back and forth. So it can be sticky, but again, it's one of these things where you, like Michael says, you want to receive the money that you're supposed to be receiving. So you have to be persistent.
I see we have another question in the chat from Eden. Can you start a private practice if you are unlicensed? And how do you define your role as a counselor? I hope I did that justice, Eden.
Yes, thank you.
I don't know if any one of you wants to grab that question.
Well, I would say, and you guys jump in if you want, but I would say if you're unlicensed, I mean, the basic issue is that licensure laws provide both title protection and scope of practice protection. So I would recommend not starting a private practice if you're not licensed. If you were to do that, you would have to call yourself, you couldn't call yourself a psychologist, you couldn't call yourself a counselor or mental health counselor. I'm not sure. I don't think psychotherapist is
you can call yourself therapist. That's the only
therapist. Yeah. So, but you run into, you can't get paneled, I don't think, right, if you're not licensed. So I would say in general, Eden, I would wait until you're licensed, because I think it's much more complicated and much more restrictive.
You also Can't get
and-
malpractice coverage.
Right.
Oh, that's a great point.
Yeah,
You can't get
that's
malpractice
huge.
insurance
Yeah.
coverage. Right. Thank you, Ashley.
Gotcha. Thank you. I was just wondering if it was something that I could explore while I'm in the process of licensure.
Unfortunately, probably not. Sorry.
To do all your legwork though, like starting to market
That's true.
yourself and kind of getting all your spreadsheets set up. So then you're just good to go.
Yep.
Great.
How about
Thank
other
you.
questions? You're welcome.
The other thing you
Meredith,
could
whether, oh,
I was just going to say that what Michael did is also a path where if you have a master's degree, you can get your LMHC, you know, as a licensure, and then if you're still in process with your PhD, then you can use that. If you have a what they consider a terminal master's degree, not like part of a program where you start and continue through, but if you've gotten a master's degree separately, then you can get your licensure.
Yeah, I currently have my doctorate from William James. So,
Yeah, but you're not able to practice yet, so that's the question, right?
right.
But if you have a master's degree, then you could. If you have a master's degree that you like what Michael did.
Okay, thank you.
Were there other questions, Meredith, that you had gotten?
I did not see any other questions in the chat. I'm wondering though if there are other questions out there where people haven't put it in the chat, or if they would like to unmute themselves and ask. Now's the time. We'll take a few more minutes for that.
Hi, I do have one more question. You briefly mentioned authorizations, and I was curious, how often do you have to do an authorization for insurance now?
You know, with different insurances are different. Most of them do not require authorizations at all anymore, to be honest with you. But there are some that, like United has one that you have to do every 6 months, and you do it online, and it takes, you know, like 2 minutes to do. I think actually they're all moving to not having authorizations required. I think even the one, you know, most of them, like Tufts, used to require an online authorization, but they're just not micromanaging it anymore. So, but if you do have to do it, it's very quick.
Thank
Yeah.
you.
Yeah, I never come across it anymore. Like you're saying, Jonathan, Tufts used to have notifications, but as of January 1, they got rid of those. And yeah, they were annoying, and you just did it I think it was every 8 sessions, and it took like a minute or two. And I just had to keep track of it, or just not like, oh, am I not getting paid? Notification, damn it.
Yeah. Right.
Great. Thank you for that question, Nicole. Other questions other people might have?
A question. One, thank you all for being here and taking the time. For people that have made their own websites, are there any like website platforms that you would suggest for starting that process? I'm not tech savvy in particular, but just kind of to start that, what would you recommend?
I would recommend Squarespace. I didn't actually make the website myself. This is another one of the areas where my partner is very helpful. Get all the help that you can get from friends and family is all I'll say. I know that Squarespace has a really awesome way to kind of look at templates and then put in the information that you need in there. They have like themes and all of the pieces that you can pick from there, and it makes it super easy. So I would recommend Squarespace because that's the one that we're using now.
We've had luck with GoDaddy. It's very simple and straightforward. You can start a website in a matter of 10 minutes. The other thing that I would recommend is that it's on the internet now. You can, if you wanted to do something creative, like if you want to develop a logo or something, there are these platforms that have like contests. So you put in a certain dollar amount that you're trying to, you say like for $100, I would be willing to pay for a logo, and they get 3 or 4 people putting entries in there, and then you can pick one of them and then work with them specifically. And it's a very inexpensive way to get something unique on your website.
I have a question. I've been out of clinical practice for a while, and I'm looking to get back into it. But when I was practicing practicing, it was always as part of a treatment team or in collaboration with other people. What do folks do just in terms of, I don't know, I guess maybe not feeling isolated from other practitioners? Do you have peer support, or what kinds of things do you do to help with that?
So I'm solely on my own as a practice. However, we're required for a licensure to maintain supervision. So I have a biweekly supervision group, and that's part of my informed consent process with clients, with three other providers in the area. And then I'm part of a monthly eating disorder supervision group. But it's such a huge part of connection. And my building itself is mostly therapists, which will be nice post-COVID world, I think. But it's an important part of doing the work effectively, but also a really important part of your license.
Also, what Ashley mentioned before about the groups online, there's one on the North Shore where I am. It's called Private Practice Colloquium. And so it's basically an online chat room with people talking about cases and difficulties that they have. And it's really very helpful. And I think that goes across most of Massachusetts. The other thing I would say that's very helpful is not so much about collegiality, but it's nice that the APA has the insurance trust. I don't know how many people use that for their insurance, but there's a risk management division of that, and I use them regularly. So if you're ever feeling any kind of question about practice or anything to be worried about, you call them up and they have somebody to talk to within a couple of days. So that's very helpful to know about.
Great, thank you.
I see we have another question in the chat. If you do want to be on insurance panels, how many in general is a good recommended number, if any?
I would say as many as you want to, as far as that goes. I mean, it depends on how, nowadays I think you can be as busy as you wish. And the insurance panels, then, a lot of people just go with the Blue Cross Blue Shield because they pay the best. And that makes sense because there's enough patients to be seen. I was, doing a group practice and for community-based service. So I tried to do all of the insurances, but it's really, I think you want to be selective to some degree, but it's not going to be a problem for you to be on as many as you wish. You can regulate it yourself, but you will see differences in fees that are quite significant. So.
Yeah, I'm only on Blue Cross's panel, and that's really it.
So I think that's a really good point. I think to Jonathan's point, you can be on as many as you want. Gureen is on one and has a thriving practice. So it just depends on sort of where you're at and what you're looking for, I think.
Mm-hmm.
Great. I see we're going to take one last question from the audience, and then I know I'm going to hand it back over to Susan. We have a question from Callie Moore. Are there any tips on how to go about finding a supervision group once you are on your own? For example, if moving to a new state and starting a private practice?
So I think in thinking about starting your private practice when you're moving to a new state, you're going to be doing a lot of networking. And that's a good way to just kind of start to connect with other people. If there's someone that feels like they're kind of in a similar field, similar licensure, good referral source, just putting yourself out there, asking if they have a group they're part of, or if they'd be willing to start one. And that listserv, that's a pretty common thing in communities. I don't know if you guys are aware of any down in Mass, but the one up here is great. There's people reaching out all the time about wanting to start a new supervision group or join one. So I would say just through your networking process, letting them know you're going to be new to the area, and if anyone knows of any, if they're willing to give you their info.
And I would just say, just as a quick aside, I know that we have a group of students from that graduated from the counseling program, like, I don't know, 5-6 years ago, something like that. And they continue to meet. There are like 5 of them, and they meet once a month, and they've done this since they graduated. It's a group of alums, and they call it super group supervision. So, and again, I think with Zoom and other, technological advances we have, you can do that with people in other areas as well. But you can also always check with your state counseling or psychological association and see if there are options there to connect with people via consultation groups also. Meredith, is that it?
You are our moderator.
Oh, I meant though, is that it with the questions? You
Oh,
don't have any that were
yes,
sent to you.
Yes, that is it with the
I'm sorry, I should have been clearer.
No, that's all
Do
good.
we
So-
have your permission to end? Okay. And Jonathan just posted some things in the chat as well. I guess I would just say to our panel, sorry?
I was just saying that's what she asked about the listserv. That's the one
Yep.
that I use.
Great.
Yeah.
Thank you. I just
Yeah.
wanted to thank Jonathan, Michael, Ashley, and Gureen again for being here. You guys, seriously, it's great. You provided such helpful information. Much appreciated. And I just wanted to leave this with, if any of you have any final comments you would say to people as we wrap up tonight. You don't have to have, but if you do.
Just say, don't be afraid to do it. I think Gureen touched on this too. The anxiety, I feel like, is so normal at the beginning and it fades very quickly. And just having some supports around you and colleagues, networking, it really helps kind of build that confidence level up. If anyone had any other questions or wanted to reach out at any point, please feel free. I'm happy to be a mentor or support.
That's great.
Yeah, I second all of that, and just, go for it. If that's what you want to do, you'll figure out all the stuff if you want to deal with insurance or not. There's lots of little details, and there's lots of resources out there, and we're all happy to help you out with all of this stuff.
Thank you.
Yeah, I would echo that as well. And if people are interested, one of the reasons I was doing this was to see if people were interested to join Medical Psychology Center in Beverly. It's a good practice. It's collaborative, and we have a great practice manager. One thing I would say also is, like, I'm coming to the end of my career, and I feel so honored by the work that I've done. And I think each of you, in the sense of you helping people, and things have gotten, significantly more difficult over time, but it's a great profession. And it's hard sometimes in terms of insurance and these other things, but I would say overall, it's really, people honor you with their pain, and that's a beautiful thing. So.
Thank you, Jonathan. I would just say quickly, unfortunately, if you're master's level, you can't do private practice until you're licensed. They won't let you count private practice hours toward licensure, which I don't agree with, but I don't make the rules. So, Gureen, did you have anything? I don't mean to put you on the spot, but I am.
Thanks, Susan. I appreciate it. No, I just wanted to end by saying thank you so much to really everybody for coming in and listening to us chat about this. I am also available to connect with folks for any future questions or conversations. I'm happy to put my email address in the chat for everyone. And please really reach out. It can be quite an isolating process going through prior practice. So please know that there are people who are around to support you, to help, to guide, and answer all the questions in between. So thanks, everyone.
Thank you, Gureen. And again, thanks to all the panelists for just your generosity of spirit and time. This has been a really great event. So thank you for helping, and thanks for all of you who attended and asked questions.
And thank you, Dr. Susan Powell, for.
Well, thank you. I didn't have to do anything, so they did all the heavy lifting.
Thank you to you and to our panelists.
Yes, absolutely.
Very rich discussion, and I see Gureen has put her email in the chat if the other panelists would like to do that as well.
Ashley did that as well, I think, didn't she? Yeah, Ashley did that also.
Excellent.
Michael?
So, people have the follow-up questions that we were unable to get to this evening. Thank you to the panelists for being so generous and sharing your contact information. I also wanted to add that Jonathan, Dr. Inns, your opportunities, I believe we have posted in Career Link since you and I spoke last semester.
Yes.
If you have updated opportunities that you would like me to post for our community, please feel free to send those along to me, and we'll push those out again to our students and alumni. And this evening has been recorded, so I will be pushing this out to our community as well. So if people logged on a little bit late and you missed the beginning, you'll be able to see the whole program in its entirety. So thank you again to everyone for being here, and enjoy the rest of your Thursday night.
Thanks, everyone.
Thank you.
Take
Thanks
care.
for having me.
Yes, thank
Nice
you.
to see you. Yeah.
Thank you, everyone.
Bye, everyone.
Bye-bye. Bye-bye.